Hi, my name is Jim Pelot. I'm the Chief Financial Officer of ArcticDX, headquartered here in the Mars Center. I've been asked to talk about the power and the promise of genetics. We have a test on the market for age-related macular degeneration, which is a devastating disease that affects 1 in 10 Caucasians will go blind from this disease in their lifetime. It turns out that age-related macular degeneration is primarily a genetic disease that takes a while to show itself. The interesting thing about the way we've taken this to market is that we have relied fairly extensively on the healthcare economics in the American system to support the use of the test in clinical practice. I know there's lots of discussion about the impact of genetics in helping patients and helping clinicians do their job better, and this test that we have called Macular Risk does that. But we also wanted to take a look at the healthcare economics to make sure that it was returning a benefit to the healthcare system. And in conjunction with a group called the Center for Value-Based Medicine at the Wills Institute, a couple of ophthalmologists there who specialize in healthcare economics performed a study earlier in the year that demonstrated that this test, which assists clinicians in identifying patients at risk of going blind from this disease earlier in the life cycle of the disease so that treatments can be applied effectively. These folks in the healthcare economics have demonstrated that for every 1% of people who are identified earlier, the U.S. healthcare system benefits to the tune of $197 million. Almost 80% of people who develop blindness from this disease are identified too late for effective treatment. So we know from the healthcare economic study and the feedback that we get from clinicians that we are having a huge impact both in patients' lives and in the cost effectiveness of the healthcare system. And that, I think, is the combined power and promise of genetics.